So I guess you're going to hear a talk or two from a tough Sicilian American. Thank you so much for the lovely conference. It's an honor to be here. So this is going to overlap a little bit with Dr. Pess's talk. It's on double dose concurrent administration of collagenase in the same hand. We do have a number of disclosures, most of which is research support, consultants for these various companies, and partial royalties for Xiaflex, Xiapex for myself and Dr. Hurst. So the purpose really was to investigate the safety and efficacy, as I heard from Dr. Pess, of 2 concurrent injections of collagenase. And there were 56 sites, and I'm going to be pitching, collection of large data sets, especially tomorrow in our clinical research symposium. And patients were enrolled for 2 or more contractures of at least 20 degrees or greater in the same hand, affecting at least 2 joints. And they received 2 0.58 milligram collagenase injections, followed, as you heard from Dr. Pess, from 24 to 72 hours later, and the follow-up was at 31 days. Change from baseline in flexion contracture. We measured range of motion. We used our prior clinical trial rate of clinical success as essentially a straight finger, and rates of clinical improvement greater than 50% contracture reduction. And of course, if a patient sneezes, that's an adverse event, and we record everything. So as you heard, there were 714 patients analyzed for efficacy, and these are the joint pairs. That's quite a lot of joints, 1,448 joints, 896 were MP, 552 PIP. And these are the results. So for a total reduction of all the joints, there was a 74% reduction in contracture, reading from that side to this side. So if we look at the joint pairs showing for different fingers, there was an 84% mean decrease from baseline. And if we look at the joint pairs for different fingers for PIP, there was a 61% decrease in contracture. Again, with different fingers, 1 MP, 1 PIP, a 68% decrease in total contracture. And in the same finger, and importantly, this is where the N number is highest, 1 MP, 1 PIP, you see a 72% decrease. And as has been presented, for the same joint pairs, you can also see a significant increases in total range of motion for these various joint pairs. So the overall, by our definition of clinical success, that is essentially a straight finger using these 2 doses in the same hand, essentially a 64% success rate. And that's for MPs, and for PIPs, it's less, a 28%. And for clinical improvement, that is greater than a 50% contracture reduction, 89 for the MPs and 71 for the PIPs. The patient's point of view is always most important, as we all agree. And so, at least in the United States, our FDA is really demanding that at the least we survey the patients and their feelings as to the treatment. Not if they like you or not, because, but how is the treatment in your point of view? And this is what we found in this fairly large study, that most of the patients were either very or quite satisfied. So that speaks a little bit to the data on the 50% contracture reduction. I mean, in trials, in order to get a drug approved through our FDA, we had to have a very strict primary endpoint, and that's why we chose a straight finger. But in clinical reality, if you reduce a contracture to a patient's satisfaction such that his or her hand is functional in their point of view, that's very important too. And so these are just a few examples. Here's a patient with PIP contractures on the ring and long finger, and his result of his double dose injection. And here's a little bit more complicated case, and here's the result. And on this particular patient, you can see that this patient on the bottom here had prior surgery, so that was interesting. And as Dr. Pess pointed out, these were the adverse events. Again, the incidence of skin laceration was a little bit higher, 22%. So in conclusion, the concurrent administration of collagenase in the same hand decreased total contracture and increased range of motion. And efficacy and safety were similar to prior studies, although the skin lacerations at finger manipulation were higher. And there really doesn't appear to be a greater risk of using the 2 doses concurrently as compared to 1 dose. And this method may allow for more rapid treatment of 2 affected joints. And as has been mentioned just very recently in 2014, this method was approved by our U.S. Food and Drug Administration. And so I'd like to thank you for your attention, and also thank my institution for the fabulous support that I received there, and the funding organizations that have gotten Dr. Hurst and I through the wars of clinical trials. Thank you.